Today we'll talk about specialized connective tissue. So welcome to the video. Please subscribe the channel if you have not done so that you don't miss any videos. So before going to specialized connective tissue, let's know what are specialized connective tissue. Specialized connective tissues are cartilage, bone, and the blood. Today we'll be talking about cartilage. In the next classes, we'll be talking about bone. And the connective tissue class is already taken. If you have not watched, please watch the video and come to this. So osteochondroma is an overgrowth of the cartilage that is marked here as a yellow arrow. And it is also a growth of bone. So it's a bone, it's a growth of cartilage and the bone that happens at the end of the bone near the growing plate. So it's yellow colored area. So chondroblastoma is a rare, which is a benign condition, locally aggressive bone tumor that occurs in the epiphysis or apophysis of long bones. So I just described these things. These are abnormalities. So to detect these abnormalities, you must know what is normal. So we have seen some abnormalities of bone and cartilage. Now let's see to understand the normality of the cartilage. So specialized connective tissue consists of cartilage, bone, and hematopoietic tissue. So let's talk about the cartilage. So it's a specialized connective tissue. And it shows strength, provides firm support, also allowing flexibility without any distortion. And it is resistant to compression. It is avascular, as we have seen in the skin, but derives nutrition through diffusion from adjacent tissues. There are three types of cartilage: hyaline cartilage, elastic cartilage, and fibrocartilage. Let's see a cartilage here in this diagram and components of cartilage. So cartilage is a connective tissue. So connective tissue consists of cells and matrix. Cells are responsible for production of matrix. Matrix consists of fibers and ground substance. So you're going to see the same things here. But the cell in this will be a cell of cartilage. In connective tissue, the cell which is responsible for producing matrix is fibroblast. But here it is going to be a cell of cartilage. We will see what are they. So in this, the cells can be seen. It's mentioned as chondrocytes. Can be seen in groups here, which is having a space surrounding it, and that space is called lacunae, and the matrix also can be seen. On the outer aspect, perichondrium can be seen, which is covering of cartilage. Perichondrium is covering hyaline and elastic cartilage. So it is present only in hyaline and elastic cartilage. It is absent in fibrocartilage. It is having two layers: a fibrous layer, which is outside, and an inner layer, which is called chondrogenic layer. Chondrogenic layer will give rise to the young cells of cartilage called as chondroblast, which starts to produce cartilage matrix. Let's see cartilage matrix in detail. So this figure shows the cartilage cell. A space on which it lies is called lacunae, and there are a group of cells can be seen here. And the newly produced matrix takes deep stain, and that is called capsule, also called as territorial matrix. interterritorial matrix also can be seen. Matrix is homogeneous and basophilic. So it takes the basophilic stain, that is hematoxylin stain. So it looks little bluish in color. While comparing to other cartilages, hyaline cartilage will be the one which takes most of the basophilic stain, and the hyaline cartilage almost looks like bluish in color. So generally, matrix takes a basophilic stain. Now, cartilage cells are placed in lacunae, as we discussed before. Ground substance contains chondroitin sulfate, glycosaminoglycans, glycans, hyaluronic acid, which is closely associated with some fibers, elastic fibers and collagen fibers as well. So when I say collagen fibers, hyaline cartilage contains collagen type 2 fibers, whereas elastic cartilage will contain elastic fibers, and the fibrocartilage will contain collagen type 1 fibers. So these are the differences between the cartilages. Here also I mentioned one difference, that usually the cartilage matrix is basophilic, but more basophilic stain you can see in hyaline cartilage. Now, recently formed ground substance which surrounds a cell, the newly formed matrix, which takes the deep stain, and that is called capsule, as I mentioned before. And the nuclei of the cells which are placed here, the nuclei are large. Nucleoli can be one or more. Cytoplasm is almost basophilic in nature. Let's see the types of cartilage cells. So we can see a series of evolution of the cells. Mesenchymal cells, which are the mother cells or stem cells, which give rise to chondroblast. Later, chondroblast give rise to chondrocytes. Chondrocytes are large, which are encapsulated cells lying in a matrix and surrounding a space called lacunae. Lacunae can be seen here, and it is lying in the matrix. In fact, the matrix is produced by the cartilage cells. When occurring singly, they are almost round in shape. But when they are, as you can see here, when they are single, they are spherical in shape. But when they are together, the opposing side compressed as this. So it can be seen in groups of 2, 4, 8 cells. And these groups are called as cell nest. Here 1, 2, 3, 4, 5, 6 cells can be seen together. Here 2 cells can be seen together, and they are called as cell nest. Cell nest is a feature of hyaline cartilage. Now the other cells which we are talking about, in different types of cells that we are talking about here, is mesenchymal cells, chondroblast and chondrocytes. So mesenchymal cells giving rise to chondroblast. Let's see about chondroblast. So chondroblast are young cells. They are relatively small while comparing to chondrocytes, and irregular, having a lot of branches or branching processes. They have euchromatic nuclei and they take up basic diet because their activity is high. And here in this diagram, perichondrium and the inner layer of perichondrium, which give rise to the chondroblast. And chondroblast, as they go into the center of the cartilage, they divide. And the chondroblast produces matrix. As they go in, they start to produce more matrix. And ultimately, they will be lying within the matrix. And that stage, we call it as chondrocytes. So, chondroblasts are giving rise to chondrocytes, or chondroblasts are transforming into chondrocyte when they produce matrix, and ultimately they get trapped inside the matrix. There can be two growths of the cartilage, which are classified as positional growth and interstitial growth. Positional growth is when the perichondrium differentiate into chondrocytes and start producing matrix. And it is adding into existing cartilage. So this type of growth, that is growth from the periphery, is called positional growth, where chondroblast is differentiating into chondrocytes and producing matrix. Whereas interstitial growth is a proliferation on and hypertrophy of existing chondrocytes. So chondroblasts are active, as I said before, and when it trapped inside the matrix, you call it as chondrocytes. But still, the chondrocytes which are placed on the inner aspect of the cartilage, they can also produce matrix. So the growth that is produced by the chondrocytes from the inner aspect of the cartilage is called interstitial growth. So appositional growth, that is from the periphery, from the perichondrium, the inner layer of the perichondrium, that give rise to chondroblast. Chondroblast start producing matrix in large amount, active cells. Once they produce matrix and they get trapped inside the matrix, you can call it as chondrocytes. But the chondrocytes still produce matrix within the center of the cell, and that is called interstitial growth. This type of growth is interstitial growth. The cartilage growth can be explained in this way. Perichondrium, the inner layer of the perichondrium, that give rise to chondroblast. Chondroblast secretes matrix. As they secrete the matrix, they move inner aspect to the cartilage and they get buried inside the matrix, and then it is called a chondrocyte. Even though they are inside the matrix, they have still ability to secrete some amount of matrix, and they do that. So the initial stage where the chondroblast produces the matrix and they are derived from the inner layer of the perichondrium, and they increase the cartilage size from the periphery, that can be called as appositional growth. Whereas once they become chondrocytes but still has the ability to produce the matrix, and that growth is from within, that is called interstitial growth. Differences between chondroblast and chondrocyte. Chondroblast is given on the left side and chondrocytes are given on the right side. So chondroblasts are very active and they produce components of extracellular matrix. They are the fibers and the ground substance. Whereas the chondrocytes are the cells which can still produce some amount of extracellular matrix and they become embedded in the matrix. Chondroblasts are derived from mesenchymal progenitor cells, whereas chondrocytes are derived from chondroblast. Chondroblasts are considered to be immature cells, whereas chondroblasts are mature cells. Chondroblasts secrete components of extracellular matrix, whereas chondrocytes are also producing matrix and also involved in nourishment and maintenance of the cartilage. Chondroblasts are responsible for appositional growth of the cartilage, whereas chondrocytes are involved in interstitial growth of cartilage. Let's come to different types of cartilage. There are three types of cartilage. First one we are going to talk about is hyaline cartilage. So hyaline cartilage, the peculiarity is that the cells in the hyaline cartilage are arranged in groups and called as cell nest. Perichondrium also can be seen here. Ground substances appears homogeneous and takes blue stain. This area, the ground substance that takes more of bluish stain. Collagen fibers in the ground substance which has same refractive index as that of ground substance. That is why here fibers are not visible. But actually the fibers which are present here are collagen type 2 fibers. They cannot be seen because the refractive index of the fibers and the ground substance is same. And they are present in trachea, tracheal cartilages, bronchial tree, nasal cartilages, costal cartilages, which are near the ribs, articular and epiphyseal cartilages, thyroid cartilage, cricoid cartilage, and basal part of arytenoid cartilage. These areas, hyaline cartilage is present. Perichondrium is present in the hyaline cartilage, excepting in articular cartilage, because articular cartilage is also a hyaline cartilage, but their perichondrium is absent. Otherwise, hyaline cartilage has perichondrium. This is how the cell looks. The group of cells called cell nest. Chondrocytes are arranged, and they have a space surrounding it called lacunae. The territorial matrix, which is newly formed ground substance, the matrix can be seen between the group of cells. There is interterritorial matrix. Let's see the next cell, elastic cartilage. Elastic cartilage looks like this. The cell size of elastic cartilage are bigger than that of hyaline cartilage. Ground substance has a lot of fibers, and these fibers are elastic fibers. So elastic cartilage, obviously, it will contain elastic fibers. Perichondrium can be seen, and cartilage cells are also can be seen. The cells are quite bigger. Size of the cell is quite bigger, and they are found in the ear, pinna, external acoustic meatus, auditory tube, apical portion of arytenoid, corniculate cartilage, cuneiform cartilage, and epiglottis are examples of elastic cartilages, whereas the basal part of arytenoid cartilage is hyaline type of cartilage. So in fact, elastic cartilage has the largest cartilage cells. Lacunae can be seen here. This is how elastic cartilage looks like. It's a picture of epiglottis, where chondrocytes can be seen, and they are in the lacunae matrix. Elastic fibers can be seen, perichondrium as well. The next type of cartilage is fibrous cartilage. Fibrous cartilage do not have perichondrium, that is understood from this picture, and the cell size is very small. In fact, fibrous cartilage has the smallest cartilage cells. Then the hyaline cartilage has little bigger than these cells, and the elastic cartilage has the biggest cartilage cells, and they are very small in number and occur mostly singly. And the fibers which are present here are type 1 fibers, which are running parallel with each other, and they are separated, and those gaps are occupied by the cartilage cells. As I mentioned before, perichondrium is absent, and they are seen in intervertebral disc, articular disc, pubic symphysis, and labrum of ball and socket joints. Thank you.